We wanted to take some time to focus on your questions about the vaccines. So we've brought in Dr. Kavita Patel, former health policy director for the Obama administration, also an MSNBC medical contributor. Also, Dr. Amish Adalja. He's a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. A big thanks to both of you. And Dr. Patel, we'll start with you because we haven't seen a lot of research on the effect of vaccines in kids. Our first question comes from Twitter. This is the first Twitter question here. Very simple. Is there any news regarding COVID vaccines for children?
Yeah, Craig, great questions. We're going to try to move through them quickly to get to as many as possible. So Moderna and Pfizer have closed enrollment for children and adolescents above the age of 12. Remember, Pfizer is authorized for ages 16 and above. So keep that in mind. That's ready now. But Moderna and Pfizer have closed enrollment 12 to 17. We'll be waiting for those trials to unfold. It should be in the next several months, though, Craig, that we'll get more information. And Johnson & Johnson is in trial with 12 to 17 and also has plans already for younger age groups, including infants. Most likely 12 to 17, possibly younger, could see vaccinations as early as this fall, authorized through the FDA.
In just in time for the start of a new school year, it would seem.
That's right.
Dr. Adalja, we've got a question from a concerned mom. She writes, my daughter is 14 weeks pregnant and teaches kindergarten. The children do not wear masks, but she does all the time while teaching. Her obstetrician does not believe she should get the vaccine now because she's not high risk. He doesn't feel there's enough information for pregnant women yet. Is there any new information about the safety of vaccinating pregnant women, Dr. Adalja?
We're getting new information every day as more pregnant women are vaccinated. And I am somebody who advocates that pregnant women get vaccinated because they have higher rates of C-sections, higher rates of preterm birth, and the mother is more likely to require ICU level care. So this is something we should do. And you look at the CDC data, these registries, we see that there's been tens of thousands of pregnant women who have been vaccinated already, and we're not seeing any kind of side effect or any kind of safety signal that's worse than the background. So this does look safe for all of the vaccines. And remember, the Johnson & Johnson vaccine is something that's used for Ebola vaccines, and that's been given to pregnant women as well. So I think this is a safe and an effective vaccine in pregnant women. We're getting more data, and it also is one way to pass antibodies from the mother to the developing fetus and then protect your infant for some period of time. There's data to that effect. So I think pregnant women should be getting vaccinated.
All right, let's talk about booster shots here, Dr. Adalja. This is one of our viewers had a question about booster shots specifically. We've been told that we have to use the same brand of vaccine for the first and second shots. What about boosters or annual shots? Will the brand matter, or is it too soon to know?
It's really too soon to know because we don't know what the interval is going to be, if there's going to be tweaks to the boosters to be better matched to variants that are circulating. So it may be that eventually there's another vaccine that's used as a booster. There are mix and match studies going on right now. We try to keep people to the same brand for their first and second dose, but there is CDC guidance that in extraordinary circumstances, you could sub Moderna versus for Pfizer or vice versa because they use the same technology. But again, too soon to tell. We'll get that data eventually as we follow people who've been vaccinated in natural history studies to see how well their immunity fares.
Dr. Patel, let's move on to a question about antibodies specifically here. This is Vicky, also on Twitter. Vicky writes, if someone received their second Moderna vaccine a month ago and still aren't showing antibodies, does this mean they are not protected? Really good question there.
Yeah, it's a great question. By the way, this is the most popular question I'm getting from patients as we're having more and more people vaccinated. A couple of key points. It's understandably psychological to want to check your antibodies. Just for knowledge, I had Moderna, both doses. I have not checked my antibodies because I know that this is working based on the data we saw from the trials. But Craig, not all antibody tests are created equal. And it's highly likely that that test that the viewer asked about was an antibody test for another part of the virus called the nucleocapsid, not the spike protein, which is what the vaccine helps prime your immune system to develop antibodies against. I can assure you, you likely have antibodies to that. And if people are trying to get an antibody test, make sure that it is an antibody test that looks for the IgG antibodies. It's a subtype, a specific type, but again, the kind that you would see against that spike protein, which is what these vaccines are trying to accomplish. So at the end of the day, though, it's not necessary, and trust in the science based on hundreds of thousands of patients in the trials.
Useful information there. Okay. Dr. Dolge, I think we've got time for one more here. You guys are going to stick around for the hour, but one more before a quick break. This is Tamara submitting a question on immunity. Tamara asking, or Tamara, I apologize in advance if I butchered your name, Ms. Olson, but the question is, does the Pfizer vaccine provide the same degree of immunity for people who are immunocompromised as it does for individuals who are not immunocompromised? Dr. Dolge.
This is an important question, and one we don't have a lot of data on. We have been getting immunocompromised people vaccinated, and we're seeing benefits in them, but we haven't been able to quantify the difference yet to know whether or not somebody with, for example, an organ transplant who's on immunosuppression has the same reaction as someone who doesn't. In general, though, the rule is you usually have a blunted response if you're immunosuppressed, and there's different types of immunosuppression. There's people who have HIV/AIDS. There's people who are on organ transplant anti-rejection medications. This is a pressing challenge. We want to make sure we get that data, but immunosuppressed patients should be vaccinated. We'll eventually see how much protection they get, but we know they get significant protection.
All right. Dr. Patel, Dr. Dolge, don't go far.
Thank you.
Thank you. Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to at home.
Thanks for watching.
Thank you so much for letting us into your homes during these extraordinary times.